I now recognize Ms. Tokuda from Hawaii for 5 minutes of questions.
Thank you, Mr. Chairman. Let's set the record straight on the role COVID-19 vaccine policies and boosters have played in reopening America's schools and businesses, preventing hospitalizations, and most importantly, saving lives. In the winter of 2020, when we were battling a new surge of COVID-19 hospitalizations and deaths, we needed to meet the moment and rapidly deploy safe, effective vaccines to the American people. Thanks to Democrats' American Rescue Plan, we did just that. The American Rescue Plan included $7.5 billion for vaccine distribution and administration nationwide, quickly getting shots in those arms. Of these funds, $20 million went to my home state of Hawaii, which helped fully vaccinate over 80% of Hawaii residents, one of the highest vaccination rates in the country. The rollout of COVID-19 vaccine has been so successful, and in large part thanks to the American Rescue Plan's bold investments and the Biden administration's decisive leadership to protect Americans' health and safety with common sense policies that encourage vaccinations across the board. In fact, after President Biden announced vaccination policies for federal employees and contractors in July 2021, we saw a 40% increase nationwide in vaccination rates in just 4 months. Coupled with additional measures to protect healthcare workers and robust federal investments in vaccine distribution, these policies have resulted in a decline in COVID-19 deaths by 95% and hospitalizations by 91%. Let's put this another way. In the first 9 months of the pandemic, the U.S. recorded 798,000 COVID-19 related deaths. By comparison, we saw less than half that amount in the following 2 years, from December 2020, when vaccines were first made available, through November 2022. That's a huge deal. Dr. Tan, as a physician who has been on the front lines of the pandemic, had we not taken these clear, decisive, coordinated steps to get people vaccinated as quickly as possible, would more people have died? Would more Americans today be experiencing severe illness? Would hospitalization still be strained in terms of the number of patients coming through our doors? Thank you. Now, we know that if we relied solely on immunity through infection, which was what we had prior to the vaccination being developed, when we saw more than twice the amount of deaths than we have in the last 2 years, the situation in the United States would have been much worse. The state where I'm from, in Hawaii, we saw quick adherence to vaccination requirements. This led to a record amount of vaccinations, but also what it led to was the lowest death rates and rates of infection across the country. Something else I'd like to touch upon is the importance of vaccines keeping pace with the highly infectious variants we are seeing emerge today. Dr. Tan, we know that immunity from infection alone does not adequately protect against variants. Can you explain how COVID-19 booster shots have been critical to protect us against emerging variants, but also helping us to keep schools open, a topic we've discussed in this committee, businesses up and running, and the rest of society safe as we reopen and try to keep our community clean of infection as well?
Yes, the bivalent boosters give you specific immunity to the Omicron subvariants. And that's currently what is circulating at this time. And by having high immunity to that, you basically are protecting individuals so that they are able to go out into the community and resume more activities of daily life, such as going to work, going to school, patronizing local businesses, meeting with family members, et cetera.
Thank you. You know, in the small remaining time I have left, I wanted to touch upon one other topic. Unfortunately, misinformation about vaccine safety, a side effect of the COVID-19 pandemic, has undermined confidence in long, trusted, safe, and effective vaccines. UNICEF has warned parents of the danger presented by vaccine misinformation. The world is experiencing the largest global decline in decades in the number of children receiving basic immunization. And today, these declining vaccination rates are driving outbreaks of previously controlled diseases like polio, whooping cough, and measles. Doctors, I understand, take a Hippocratic oath, we just heard about it, to do no harm. As we see a resurgence of once dormant diseases as a result of vaccine misinformation, how harmful is this erosion of vaccine confidence to the health and wellness of our children, our families, and our communities?
It is enormously negatively impactful. If we start to see outbreaks of vaccine-preventable diseases, you are going to get a lot of morbidity and mortality that may be associated with that occurring, especially in the pediatric population, in people that are immunocompromised and in the elderly. So we need to be able to control these diseases because all of these diseases are and can be fatal.
Thank you. If I'm hearing you right, eroding confidence in vaccines results in deaths. Thank you very much, Mr. Chair. I yield back my time.